Neuroscience presents in some ways the greatest challenges in all areas of medical research. And yet, incredible progress over the past decade sets the stage for unprecedented innovation and impact.
This is neuroscience's time to really transform into a highly relevant area that's going to be, I believe, at the center of healthcare reform and healthcare in general.
We have access to so much data, so much computational power, so many technologies, for example, genetics, imaging, that are all relevant to the neuroscience field. And so those are going to be the basis for how we make those discoveries that are going to impact human health.
So the mission of the Neuroscience Forum, as I see it, is really to bring together multiple stakeholders to converge upon a topic, to create an opinion, a path, new directions to inform the public as well as the scientific community.
I think one of the strengths of this forum is that it brings together different stakeholders to address issues that I would call foundational issues to the whole field of neuroscience, things that all of us deal with in our own way.
Some of these stakeholders are the scientists from universities, the pharmaceutical industry and biotechnology industry, government agencies, particularly the National Institutes of Health, and several institutes are involved in the Neuroscience Forum. Regulatory agencies such as the Food and Drug Administration, advocacy organizations, people who are connected to the people who are living with these disorders.
We are always timely with the type of issues that we are tackling. So, there was a workshop about 3 years ago about neuroscience data in the cloud. And it was the right prime time to do that kind of workshop in order for all these data platforms and infrastructures that we are trying to develop. And I've actually referred to that workshop many times afterwards.
Even as my second meeting, I was able to bring in experts from the rare neurological disease community to share their experiences. This is something that I feel very passionate about. The rare disease community is often a community that's marginalized, and it's not always a conversation that people are willing to have. But this was not the case for the Neuroscience Forum.
They help us sometimes identify things that others are doing that we didn't know that they were tackling, and that will enable us to leverage it, collaborate in the future.
And I think we do a good job of providing balance of the lived experience versus the very academic or the commercialization of some topic or idea. And I think it is an opportunity for people to hear each other.
But there's also a continuum that they see all the way through, that it's not just a one-stop shop. You're able to have that meeting, but then also see the findings in a white paper or see it in other literature, other references. You see it in symposium. And so it's not just what we do in the room and bring people together and it's done. It's not that at all. We are able to have an outreach that goes far beyond that one meeting.
What we're interested in is primarily research, but we have to get research into the real world. And so we can't do that without people, for example, from industry or nonprofits. And so I think this is a really good collaborative group to try to get things done in the real world.
Personally, it is a very rewarding type of place where I can see that we are all trying to fight for the same type of issues.
We all want to do better. We want to do better individually, but we also want to do better for society. And so being able to bring our collective perspectives together allows us to continue to walk that path.